advancement and the contribution that Burjeel Medical City has made in UAE healthcare has been significant. One of the most advances that we had was in the oncology and hematology landscape. Through this interaction, we will highlight some of the most important milestones that we achieved in our hematology and oncology at Burjeel Medical City, which has contributed to the cancer care in UAE. We do have an esteem of experts. Some of them are here, some are not, but we have Dr. Hassan Ja'far. Welcome, Dr. Hassan, who's a renowned medical oncologist with very extensive experience in the UAE, with over 25 years of experience. This experience actually has been evolving in multiple hospitals, and he's one of the most senior oncologists in the country, and his contribution to the cancer care in UAE is very well known to everyone in this field. We have also my friend and colleague, Dr. Ibrahim Abu Ghida. Dr. Ibrahim, he's a radiation oncologist by training. He is the only radiation oncologist in the country that was trained in GI radiation oncology and also breast radiation oncology, which is, again, it's very critical to improve the patient outcome when you are subspecialized, and that's what we believe in subspecialization in cancer care. And he's also the chief medical officer, one of the youngest chief medical officers in the country at the age 20. We have Dr. Amr Siddiq, who is the director of Oncology Excellence. Dr. Amr Siddiq background comes from pharma. He works in different organizations, including Pfizer and GSK, but he also has very long experience in the oncology world, and he established the bone marrow transplantation unit, which is the largest unit in the UAE with over 130 BMT with a very high success rate. Over the next 30 minutes or 40 minutes, we'll try to highlight some of the most important milestones throughout the cancer care in Burjeel Medical City, and how did this impact the cancer care in the UAE. We'll start with Dr. Hassan Ja'far, who's been practicing at the Burjeel Medical City over the last 2 years, more than 2 years, and would like him to highlight why Burjeel Medical City oncology is different. Is it because you have 7 centers across the UAE? Is it because the same day appointment? Tell us why we're different and why we're trying to do this.
Thank you, Professor Humaid, for giving me that opportunity. We know that we have a lot of centers in United Arab Emirates, and most of them, they are very comprehensive. The advantage of Burjeel, it is not one hospital, it is several hospitals that serving all the Ain, Sharjah, Dubai, so all the Emirates. And you know that we have this specialty, the BMC is the most advanced, where we have centralized the pathology lab, the PET scan, the radiotherapy. So we complete each other, and it is also facilitate the treatment to have it very close to home whenever we have the further therapy. Whenever you have the primary complicated, usually we do it in BMC. It's not only this, the accessibility of the treatment is very flexible. We have also, whenever you have a tumor board, we have many opinions. So all these centers participate and share the same tumor board. You have like more than 22 oncologists, so we don't have any centers within the United Arab Emirates that have that number. So you are not getting one opinion. You are getting more than 20 opinions. The same for surgery apply, for radiotherapy, for the pathology. We see all this in one unit, and we have it across different type of cancer. I think the progress is very fast within this. It is subspecialty in the radiotherapy. We have subspecialty in the pathology. Because it's centralized, we have more than 8 or 9 pathologists, where we have each one have subspecialized in a certain disease area. And this is the way to progress. And again, I think there is an agreement with the molecular testing. We know that currently we cannot treat cancer patients without having the molecular profiling for those patients. And there are efforts to have more accessibility to those patients. I think this is the excellence of oncology. This is moving forward. There are people thinking about how we can improve day after day. So it's not a matter that we are stopping here. We are continuing to grow. And it's not only serving our population in United Arab Emirates. They are also, we have the international group that distributing all this information to get patients and from across the Gulf area, and even international from Africa and from other countries.
Certainly. And in fact, Dr. Hassan, if you allow me, there's something special about our group. we will provide a free opinion consultation for any patient with cancer. And this something has been done because we believe that every single patient have the right to have accessibility for consultation. Certainly we cannot provide treatment for free, but at least we can give a free opinion, and this is for any patient, either Emirati and Emirati. We provide this opinion, and we try to give them and guide them where they should receive their treatment. So this is something actually we're very proud of. And the other thing also is that we have one-stop shop. If the patient comes today, he has a concern about cancer, we can do a workup in no time. There will be no appointments, come in a week time. No, we can start the workup immediately, same day. We can get diagnosed within few days. We have so many cases where cancer have been diagnosed and treated within 3-4 days. And again, we know that the cancer treatment timeline, the more delay you have, the more chances or there is more risk for patient to progress. Doctor, can you please highlight also the research capabilities and also regarding your latest clinical trial which opened at Burjeel Medical City for breast cancer?
Thank you. I think it's also a very important part that probably the clinical progress cannot be completed without this clinical research, without knowing what we have, what are the prevalence of different, whether it is a preclinical or clinical pathology or even interventional. So to know what we have, what is the progress of those treatments, what are the outcome of those patients. And again, we have a lot of interventional clinical trials that we can use very new advanced treatment that we cannot have an accessibility without these clinical trials. We have almost 6 or 7 clinical trials, 5 of them is interventional ongoing. I think this is very useful, and this is also a support for patients who cannot even access this treatment. And we are approaching the hospitals around us for patients who have probably does not have an access for treatment. These clinical trials have the incentive that all this treatment can be given for free for those patients. So this is another opportunity for patients not only to obtain a new treatment which is not available in the market, but also to have the incentive to take it free of charge.
Thank you, Dr. Hassan. And also I should highlight, we have been also very proud to provide many medication for the first time in the Middle East. Patient needs a medication, we do our best. If the patient really needs this medication for clinical indication, we get this medication. In fact, we have some patients who received the dostarlimab, which is a medication for rectal cancer and endometrial cancer. The patient received this for the first time in Middle East, in Burjeel Medical City, because we believe that we have to go above and beyond. We could tell the patient, it's not available, I'm sorry, let's try something else. But if we believe this medication is the best for the patient, certainly we do our best to try to get this medication for them.
I think you have those in a tumor board. We have the clinical studies. We have the feasibility to implement a very new data in no time after the FDA approval or EMEA approval. And this was like in a few days of FDA approved that we can use it here. And sometimes they need months to get it in Europe and even years in Europe before we do.
In fact, as I mentioned, we have patients. Yesterday in my clinic, I had patients from Qatar, patient from Saudi Arabia, a patient from Bahrain, and a patient from Oman. So we're not only talking about treating this patient locally, but also we're talking about this patient coming from abroad to Abu Dhabi and the UAE to receive treatment. And actually some of them, they're receiving treatment not available in their home country because the medication is available. And this shows how the UAE government is supporting the initiative to facilitate the availability of the medication for this patient. And in fact, there are many medication being approved, as Dr. Hassan said, in the US, and within a week or 10 days, we get them approved here. In other countries, it takes weeks and months, sometimes even years to get the medication approval. Dr. Hassan, anything else to add before we move to Dr. Amr?
I think the hematology is a very additive value, and we know that for years and years, when I was in another facility where we were discussing, and we never moved forward. I think the achievement of bone marrow transplantation, it is a very big achievement in the country.
This is a big story. Thank you so much, Dr. Hassan. I would like to invite now Dr. Amr. Bone marrow transplantation was a dream in the UAE. In 2020, we published a comprehensive review about how can we advance cancer care in UAE, and one of the recommendations was to establish a bone marrow transplantation, because certainly there are many patients, hematological malignancies and solid tumors, they require bone marrow transplantation, and at that time BMT was not available in UAE, so the decision was we should do it because it was during the COVID pandemic. There were so many patients are not able to travel because of the rules, regulation. They're not allowed. No country was willing to accept patients for traveling. So myself and Dr. Hassan, we started from day one to brainstorm. The leadership of Burjeel was very clear. Let's do this. We have the will and the interest. Dr. Amr, we lived the journey together from day zero, minus 1 year until today, where we have achieved 130 BMT, which is the highest BMT in the UAE history, with a very high success rate. Give us just some insight about this story and how did we reach this far now?
Thank you so much, Professor. And actually, I can see a lot of very familiar faces from the farm whom I came from. Actually, it was a dream for me to have a center of excellence for cell therapy, because my background in GSK was cell and gene therapy, and unfortunately there are a lot of patients whom we were not able to help because there was no center that can provide those therapies here in the region. So my dream was to try to make it happen here. And honestly, working with Professor Humaid and with Burjeel Holdings is not an easy thing, to make sure that a private entity can invest that much to make those treatments available and those platforms for patients available. That was not easy. Then we established as he said, during the COVID time, no support. The country didn't have a clear guidelines about how we can do this. In 6 or 7 months, we were able to get the approval with 100%. Do you remember that day 100%. when we get like we had the audit, and then all of a sudden we didn't know if what we are doing is optimal or not, and then we found that we got 100% on the audit that day, which was great. We started treating the first patient after 1 month from getting the approval. Currently, as Prof said, we have treated more than 130 or around 130 patients. The good thing is we have done autologous and allogeneic. And the allogeneic, the first case we have done was the toughest case ever, which everybody will not get, the haploidentical with only 50% match. So at the end of the day, I remember that a couple of days we were celebrating the birthday of one of our first patients, and wallahi I was in tears, because when you think the mother was saying, my daughter is here celebrating her birthday today because of you, and to be honest, it is because of Allah first of all. It's not because of us, but we managed it with the leadership of Professor Humaid and the whole team to really do something which can help patients, really help patients. We are not, by the way, we are not, it's not, I don't know if I may say that or not, but around 60% of those we have done bone marrow to was from Burjeel charity. So we funded those patients because we believe that we need to help those, and we are not going to achieve what we want to achieve unless we really show the world that we are doing something good. One final thing, we have taken the decision to actually submit our data and to make sure that we are audited not by local authorities but by the international organizations. So we willingly submitted our data to EBMT, which is the European Bone Marrow Transplant Society. We are part of them. We are the only center in UAE which is audited and part of the membership of EBMT. And at the end of the day, when I'm standing here now looking into the dream we had and what we have, definitely we are having challenges. There are a lot of unmet needs which we are daily working on. However, I'm very grateful for this milestone. I'm very, very grateful that being able to help those patients in the UAE, I wish One day I'll be able to do that in Egypt, in my country. However, here we managed to do it.
Your country.
I mean, yes, it is my country. I've never felt it's not my country, but I'm very grateful for the opportunity, and thank you very much, Professor.
Thank you so much, Dr. Amr. And to be honest with you, no matter how much I say, nobody will understand how difficult to go through the journey of building something that does not exist. When it comes to machines, manpower, technology, it doesn't exist. Even nurses with experience in BMT, they were not here. Like, you know, you have to start from scratch where nobody even has been there before. Even medications, we were trying to get medications, nobody has registered this medication in the country. So it was a full process that we learned, and certainly that, you know, the experience that, you know, we gained from such building a BMT unit, something that will carry on for life. And I always say, if there is no other project I would have done in my career with Dr. Amr, this will be it. Like a BMT program that's, you know, helping the country, something we're very proud of. Now we'll move with the something very important, and unfortunately not much being talked about in oncology. We always talk about chemotherapy, immunotherapy, surgery, but radiation is a very critical and component where around 20 to 30% of patients with cancer will require radiation. But radiation is important. Why anyone should think about radiation? Again, we're not trying just, you know, we're not trying to highlight just to get some credit, because actually there's a lot of work has been done trying to make sure we're delivering, you know, state-of-the-art treatment for our patient. Dr. Ibrahim, as a radiation oncologist in Burjeel, tell us about the facility, tell us about the manpower, tell us about the expertise that you have, and also tell us about your research, which is actually very fascinating as well.
Okay, thank you, Prof, and good afternoon, everyone. So it's really a pleasure to be here to talk to you as a radiation oncologist and as a patient advocate. So radiation, as Professor mentioned, is part of any cancer treatment. I would correct that 50 to 60% of cancer patients will get radiation at some point. So, and it's a field that very few people are aware of. And radiation is all about precision. So, you know, when we aim the beam of radiotherapy, it's all about making sure that we are treating the right tumor in the right direction and avoiding the organs around it. It's a very fascinating field. It has physics, it has biology, and of course it has medicine. The most important part is the collaboration between the radiation oncologist, the medical oncologist, and the surgeon. We all know, or we all have faced, or one of our family members faced cancer, right? So it's a disease that is prevalent. So we know that cancer is not treated by a physician. It's treated by a group of physicians. In the radiotherapy center that we have, we always, before we started, we ensured that our machine has been calibrated to the highest standards that is currently available. And we were surprised to know that when we applied for this, we were the first in the country that has applied for this validation. So we actually sent our machine output to University of Texas and the Anderson Cancer Center, which, for those of you who don't know, is currently considered and has been considered the #1 cancer center worldwide for the past 10, 15 years. And we have ensured that our machine that is releasing the beam, it matches the machines that are releasing beam from MD Anderson. And this is, for me, is for granted. But again, we were the first to do that in the country. And then, as Dr. Amro mentioned, we aim for accreditation. There is no JCI accreditation for radiotherapy. The only accreditation currently available worldwide in radiotherapy is called the Novalis accreditation. And we are very humbled and proud to be the only Novalis accredited center in the Gulf, not only in the UAE. So we are pioneering this. And moreover, in terms of research, when I started the department, I came from a very academic background. So I insisted that we have an IRB approved prospective registry. I'm very humbled and proud to say that currently we have probably one of the largest, if not the largest, prospectively IRB approved cancer registry in the UAE. Up to 900 patients right now are enrolled on this. So this allows us to generate data. This allows us to improve, and this allows us to share this data with our colleagues in the region and in the GCC. On a national level, as Dr. Humaid mentioned, Burjeel's presence across the UAE, across Oman, and very soon in Saudi would allow us to expand this delivery. Right now, the patients are coming to Burjeel Medical City, but we plan to reach to the patients in the future. So we are expanding. We are actually in the process of purchasing a lot of machines. I cannot disclose the numbers, but we are, there's a very strong motive for expansion with the same center, with the same portfolio, and the same guidelines that we have set. That doesn't mean that we stop improving. Our guidelines, we started 2 years ago, 3 years ago now. Every 6 months, our entire department meet and update the guidelines based on the current available data. We are probably the only center that are doing, everyone gets, why aren't you treating more? We are actually treating more patients in lower number of fractions because we believe that, this is better for the patient. This decreases the patients being off their work and it improves the outcome. So for breast cancer, we know that hypofractionation has a better cosmetic outcome on the woman's breast than after standard fractionation. With that, this is just quick bits. It is not me, it is a whole team. So radiation is a true, I don't know if Dr. Shaheen is around. He's the head of medical physics and he started the department with me from the beginning. So the physicists are essential, the therapists are very essential, and of course the collaboration with other units. Thank you, Prof.
Thank you so much, Dr. Ibrahim. And in fact, Dr. Ibrahim always say a statement or a sentence that I love and actually makes me proud of working with Dr. Ibrahim. He always says, I will treat this patient like I'm treating one of my family members. And actually this just give you how we try our best to treat patients. Sometimes we fail, sometimes patient dies, and actually something that we encounter maybe every single day. In fact, we had a patient who died this morning, but he died after we have provided the best care for him. We provided the best palliative care for him, even though he received treatment for 2 years for one of the terminal cancers, but he was satisfied, his family was satisfied. He died peacefully because palliative care is very important aspect. I will come to the palliative care with Dr. Sonia. Now I would like to introduce Dr. Amin Abyad, who's practicing oncology and hematology. He is one of the hard-working oncologists in the country, one of the hard-working I've ever encountered in my career. I've been practicing for 20 years, and I'm not saying this because he's my colleague, but really, truly, he is someone who's dedicated to work and to provide the best care for his patients. And he provides hematology and oncology, which is for me a little bit challenging. Dr. Amin, we saw 86 patients in our clinic yesterday, and around 20 or 30% of them we saw them for free. Tell us about why is this concept, why we're doing this, and also why should others do also the same? Currently, we're the only one doing this, and actually we're very proud of this, but why should others duplicate this story of providing free consultation for patients with cancer?
Assalamu alaikum. Thank you, Professor Humaid. Thank you, everyone, for joining. First of all, I'm very, very proud to be among family members here today. So, my name is Amin Abyad. I'm a specialist. I do hematology and medical oncology in Burjeel. So, to start with, we have a very, very open door policy regarding appointments in our facility, which means that imagine if someone reads a report or receives a lab test or receives any kind of info that makes this person a possible cancer patient. So if anyone has any piece of information, even if someone has a lump, even if someone has any suspicion for any malignancy, this would be a very unpleasant feeling to feel. So imagine someone who has a suspicion or even is diagnosed with cancer and has to wait for 2-3 weeks to get an appointment to see a specialist or a consultant. So we don't do this. Anyone who has any clue or even wants to screen for being a cancer patient or for having any kind of disease can just come with whatever they have, reports or documents. They can just open the door and come visit us. We will be working after hours just to see these patients. So anyone who has any clue, that they might be having cancer, they can just come visit us. We'll do all the necessary blood work, imaging studies, biopsies, whatever is needed to confirm and even to treat these patients. Whatever patient is treated outside, treated with someone else, diagnosed outside, worked up outside, had their surgery outside, it doesn't matter. Whether you have or you might have cancer, you're more than welcome to join at any time. So this is for patients who need a walk-in appointment, so you don't need to wait for 2-3 weeks or even months to see a physician regarding this disease. For even if I get a call from someone that says I have a patient that has cancer and he needs to be treated or he needs to be managed, this patient, regardless of their insurance status, regardless if they have an actual insurance coverage in our facility or not. At the end of the day, we're in a private facility. Some of these patients, they don't have insurance that covers them in our facility. These patients are more than welcome to come. We would review their chart, we would give them advice, we would give them free consultation, free of charge, just to reassure them, to give them at least a primitive plan of what should be done next. We might even contact their insurance parties requesting for special coverage because this is a special disease. We might even give them reports to help them get special coverage from charity, to get special assistance from somewhere else. Regardless of their financial status, these patients have the right to see someone who can understand what's happening and then give them at least a plan.
Can you tell us more, please, about the services that we provide across the UAE? I mean, we have 7 centers, الغربية, الرويس, Sharjah, Al Ain. Why is this, and what services do we provide across the UAE?
So, first of all, regarding Burjeel Medical City, when I first joined, I was told that this place is so special for many things, but among these things, that this place has all kinds of things that you need under one roof. So a patient that comes can be diagnosed, can be managed, regardless of the way of management they need in the same place. If they need diagnosis, biopsy, surgery, chemotherapy, immune therapy, radiation therapy, bone marrow transplant, acute hematology management, whatever they need, PET scans, we were among the very first few centers with the PET scan. So anything that this patient needs is included in our facility. So what about a patient who comes from far away? If a patient lives in Sharjah, or let's say patient lives in Al Gharbiyya, or let's say patient lives in Danna now, wherever the patient is, there is a nearby center that can treat these patients. Maybe they will need a PET scan and they will need to come to BMC, but this will happen once every 3 months, 6 months, sometimes once in their treatment journey. But the actual treatment, the continuous follow-up can be done in a neighboring facility that is close to the patient home. We have centers in Abu Dhabi, Al Ain, Sharjah, Dubai, Danna. شو بعد دكتور؟
Thank you so much, Doctor. Thank you, Dr. Amin. Now I would like to invite Dr. Sonia, who's been practicing in UAE for the last, I will not say how many years. Many years. But Dr. Sonia, she is a very compassionate physician who cares about her patient. She really delivers an outstanding care for her patient. She's always in contact with them. We're very lucky at Burjeel Medical City to have Dr. Sonia as part of our team. Dr. Sonia, she practiced in multiple hospitals across the UAE. So, Dr. Sonia, throughout your journey, you have treated thousands of patients. And as Burjeel being currently one of the few centers across the UAE that provides palliative care. Why palliative care is important? Because most people, they don't understand how important the palliative care. Why do we need palliative care? So tell us more.
شكرا. السلام عليكم. Good afternoon, everyone. Thank you, Prof. Humaid. Yes, thank you for the attendees. So actually, when we are seeing the patients with cancer and along all our journey, we are very glad and happy to see the patients, to provide them treatments, to provide them care, pain management. But those patients, we know, like some of them will progress. Some of them already they come with their family in poor conditions, poor performance status. And I remember when we started our course of oncology, we were doing also course of palliative palliative care and pain management. This is very important to consider for the patients, because we don't see a patients only as coming for the infusion or coming for the new therapies, or we are giving them hopes with the treatments. We have more and more therapies, but we know palliative care and pain management are one of the most important pillar of the treatment in oncology. We cited the hematology, the radiation therapy, the oncology as a chemotherapy, but we shouldn't forget and omit that the palliative care is one of the most important pillar. Actually, patients, when they come, they have the fear of the pain, the fear of progression. Their family are under stress. The patient himself sometimes comes but refuse treatment because he knows already inside that he is late stage. And this is very important to have this palliative care, because it procures the patients the security, it procures the patient and his family the safety, that they are in an environment that they are having the full continuation of care. The patient comes in, and when they are sick, when they are tired, when they have pain, there is always someone can listen to them, can treat their pain. And we know palliative care also is not only talking to the patient or socially, but it also prolongs the free survival of those patients, knowing that, correct me if I'm wrong, some patients, they live eventually longer and better on palliative care, because they are coming and under palliative care, they keep on this like survival and their supportive treatment, social life, psychology, pain management. Also palliative care can include also the palliative therapy, because we see a lot of patients, they are coming and they are receiving what we call palliative chemotherapy. This is also part of the palliative care. And when they progress, or when we do not have any active anti-cancer treatment, at least we have this palliative care, we have a full word. And I remember eventually when I was in another institution and I was referring patients to BMC, it was a big release for us and for the patients to have this system of palliative care, admission, patient being in hospital, in security, in safety. And eventually, if the patients and their family are facing stress of death, they will be accompanied until the last minute and they will not suffer. And this is something that very important to consider. And I think that every single institution in oncology should have the palliative care system, which I'm proud of it and proud to be also part of oncology team. And having this passion, this love for the patient is very important for all our oncology team. Thank you, Prof.
Yes, for sure, yes. Thank you so much, Dr. Sonia, Dr. Amar.
Assalamu alaikum. And I just want to say something before I leave Professor to close. I remember when I was in the pharma, we did something called the Patient Advisory Board to listen to what are the challenges and what does it mean for them to have cancer. Because we usually listen to doctors, but never to patients. And you know what? Sarah here, she was a colleague during that point of time. She was part of it. You know what patients said? We feel lonely. Lonely. Because they cannot share what they are in with their loved ones, because they don't want to burden them, and even with someone different, because you know, like a lady with a cancer, she doesn't know if her husband will understand that or not, so she just tried to feel. And when the doctor told her, I want you to rest assured that we are doing whatever we can do to treat you, she said, I know that I might die, I need healing more than treatment. So that made us in Burjeel, and I'm being very honest here, I'm not trying to, we are trying to look into it from a total perspective thing, like to try to provide healing to those patients. We are looking into getting Heidi, the administrate, like called administrative oncology. How is it called? Heidi, the administrative oncology, the one who will treat them by other integrative oncology. So we are looking into really healing patients. So whether it is chemotherapy, radiation therapy, free of charge consultation, psychiatry, psychology support. We are trying to see what we can add to these patients, how we can just relieve a bit, and we are looking into it from this perspective. That's the last thing I want to say, and I will leave it to you, Professor.
Thank you so much, Dr. Amr. In fact, we are providing for patient in Northern Emirates free consultation, palliative care also. We opened a clinic there because little bit far for patient to come to Abu Dhabi. So any patient can come and take a free consultation for palliative care or oncology. And again, this is something we're very proud of. With this, I would like to take any questions before we close. We can maybe take one or two questions. Yes, sir.
Yeah, I'll bring the microphone.
Good afternoon, Dr. Humaid. You guys are amazing. I mean, like the stuff you've really built here. Thank you for this. I'm in translational and integrative oncology, and I wanted to.
We love integrative oncology. Actually, we're opening our first integrative oncology clinic in the next 2-3 weeks.
Oh, that's wonderful,
Yes, sir.
Doctor. My question pertains more to translational oncology. I was wondering two things, please. Is there a CAR T cell available at Burjeel? And secondly, doctor, for AML patients for bone marrow transplant preconditioning, Iomab B, apasitamab is really good for BMT, but not yet approved by the FDA in the US. Is it easier to get approval here in the UAE for off-label use for these things? Thank you so much.
Let me give you the expert in BMT talk about CAR T cell. The answer is no, but there's something behind this no.
That's a very, very good question. So as you're aware, as long as you're interested in CAR T, as you know that there are a lot of debates about CAR T safety at the moment. And I'm not trying to find why we don't have it. We don't have it simply because we are currently focusing on getting the right approach for bone marrow transplant. So next step would be CAR T, and I'm working very hard. So our patients who need CAR T, we have a partner who can simply do the CAR T. We don't have it currently in Burjeel Medical City, because you know that there is a lot need to be, like the vector, the availability of machines, the availability. So we are focusing 100% on making sure that our BMT program is excellent. And then cell therapy is coming Q1 2025, inshallah. We have a partner that we are working with externally. However, there's something that I want to disclose. We are working with a new concept of the next generation CAR T. Instead of having the full vector, we are working on a part of the vector who can carry the CARs to be introduced, instead of waiting for the full vector, full viral vector. So that's something we are working on. So hopefully we are not going to repeat what others has started. We are going to start something, inshallah, totally different, bi'iznillah. Regarding the second question.
Dr. Amin is our expert in hematology.
Assalamu alaikum. So, frankly speaking, currently we are the largest transplant program in the country. We were the first, very few who did autologous transplant. Then we were the first to do allogeneic transplant. We were the first to do allogeneic pediatrics transplant. So currently we're the only one doing this. I don't believe that we should be jumping from one level to another without being very well established with what we're doing already. We're very happy with the results we already have. CAR T is the next level of the cellular therapy that we're doing right now. It will come very soon, but we're gonna make sure that we are going to do it very safely and very efficiently for the patients before we start doing it. And for the second part of the question, until now we're supposed to be using FDA approved, well-known therapies, for example, for transplant. I don't know if you've clinically worked in transplant, but transplant is a very complex process in which quote unquote, you bring a patient very close to death and then you bring them back. So I don't think in this setting you're supposed to be using, unless inside in a clinical trial, you're not supposed to be using off-label medications.
Thank you so much. With this, we'll conclude. And before I close, I would like to highlight that, in Burjeel Holding, we believe in research. For this, actually, we published the first book about cancer care in the Arab world, which was published 2 years ago. We made this available for free. The market value for this book was more than $20 million because the value was $50 per book. The download was 450,000 downloads, and we made it for free because we believe for the free access for knowledge. This is the second book. It's coming soon, anytime in the next 2-3 weeks. You can Google it. It will be available for free as an electronic PDF, but you can also purchase from Amazon, a pre-order. It will be only a cost of the book, but we believe this is going to be a landmark book which will establish how should we advance the cancer care in the UAE. With this, I would like to thank you for your attention and wish you all the best and enjoy the rest of your conference. Assalamu alaikum.
Thank you very much for all joining us today. And yes, that's going to be available very, very shortly, very soon, in fact. And yes, if you'd like to know more about patient care by Burjeel Medical City, you can find the series. It's available H for Hope on YouTube.